Good afternoon or good morning to you based on wherever you are in the country. Thank you so much for joining us this afternoon. My name is Nathan Schaefer. I'm the Vice President of Public Policy at the National Hemophilia Foundation. And I'm here to welcome everybody, go over a little bit of logistics, and then we'll get started with our speakers. Joining me today from NHF is Marla Feinstein, and our colleagues from the Hemophilia Federation of America, Miriam Goldstein and Mark Hobrach, are going to be talking about the American Rescue Plan and what it means for your health insurance, what the new options are, and what the lower cost can be for health insurance coverage. You're going to hear from each of the speakers, and they will be going through a number of slides, all of which will be available to you at the conclusion of the webinar today. We encourage you to submit any questions that you have into the chat function. They will be answered at the conclusion of the presentations. And finally, I just wanted to say a huge thank you to the organizers today, Marla and our friends at HFA. The national organizations have been trying wherever possible to partner on initiatives that are of great importance to the community. So I just really want to thank HFA for their ongoing partnership. And thank you all again for joining today. Again, questions into the chat function, we will get to them. And with that, I'm going to turn it over to Marla. Thank you again so much for being here.
Thank you, Nathan, for that introduction. We rarely get to share good insurance news, so we're taking full advantage of this rare occurrence. So the goal of today's webinar is to broadly go over what the American Rescue Plan is, right? It's often referred to throughout this presentation as the ARP. So what the plan is, what it does, what it doesn't do, and how you can see if you're eligible for lower, yes, in fact, I said lower, monthly premiums. We'll only be going through the health insurance related parts of the law, so don't worry about being weighed down by some of the other aspects of the law. In short, this law, the American Rescue Plan, it expands your, oh, next slide, please, sorry. In short, this law expands your marketplace insurance options. And we're gonna walk you through that, because this is a really broad, sweeping $1.9 trillion law, which was designed to explicitly respond to the COVID crisis, meaning by providing some economic relief for individuals, families, businesses, schools, states, and local government. But right now, we're just gonna focus on the health aspects. But you may be asking, why was this needed with respect to health insurance anyway? So there's two main reasons. One, the 30 federally operated marketplaces were closed, meaning you would only be able to enroll in a plan if you had what is known as a qualifying life event. And the traditional qualifying life event, meaning marriage, birth, death, etc. The second being loss of job-based insurance coverage. A lot of people who lost their job as a result of COVID, or who saw a marked reduction in the number of hours worked as a result of COVID, and the related income changes were making health insurance broadly affordable. It's important to mention that this is the first time since the ACA passed nearly 11 years ago that the ACA has been changed, albeit shortly, for a finite period of time. But what the ARP does is it broadly strengthens and expands the ACA to make the insurance more affordable for you, the patient, the consumer. So what does it do? It allows for you and your family to get marketplace coverage, upgrade your current coverage. So if you currently have a marketplace plan, you can switch marketplace plans. And finally, to overall lower your healthcare costs. So for example, if you previously had not enrolled in the marketplace because the coverage seemed too expensive at the time, there are new benefits included in this plan that will enable marketplace coverage to make it more affordable. But this is just a reminder in general through this presentation, and we'll summarize it at the end, that these changes are temporary, right? For at most 1 or 2 years. And while we hope and will continue to advocate that these will be made permanent in follow-up packages, they do provide important new opportunities that we felt as the member organizations that you needed to know about, and that these cost savings available are available now, meaning like right now. Next slide, please. HHS estimates that there's roughly 7 million Americans that are now eligible for no cost marketplace insurance? And I said no, and I mean zero. So how do you know if you're affected by some of these changes? Basically, it applies if you're in any of the following categories. So if you're currently someone who is uninsured, which hopefully you're not, right? Because we spend a lot of our time making sure that everyone has access to insurance. Or someone who buys their own insurance. And when I say buy their own insurance, meaning non-job-based, either on or off the marketplace. And we'll go through a little bit more of that in a moment. Or someone who at any point in 2021 has received unemployment insurance. So this could be, if you received it for a week, this applies to you as well. Or if you've been laid off but elected to continue your previous coverage through Cobra, this applies to you. But as with most things, these changes generally do not impact individuals who currently are employed currently get their insurance through their employer or through Medicare. Now let's go through some of these changes more specifically in greater detail. Next slide, please. Let's start with the new opportunities to either enroll and or upgrade your new coverage, right? Because you're all sitting here going, you said lower cost, but how? So the federal marketplaces, the 30 federal marketplaces, the rest are state-based or are open now till August 15th. The state-based ones are also open, but they may have different deadlines in terms of closing. For example, New York State is open now until the next open enrollment period, but that's just New York State, which is a state-based marketplace. Excuse me. Okay, so this is to enable someone who is uninsured, which again, hopefully you're not, you can now get coverage. Also, people who bought individual policies off the market can now buy marketplace plans. This includes everyone who bought an off-marketplace plan because they earn too much, and we'll go through that in a moment, to qualify for any sort of subsidies under the previous law the previous ACA law. This also includes anyone who has bought non-compliant health plans. And last or the summer before that, it's been a very long year, I can't tell you, right? These are the non-compliant or junk health insurance plans, which are the short-term limited duration plans or the ministry sharing plans, because those are inadequate and are not considered comprehensive coverage, right? They provide very little financial protection, but they also provide less robust benefits. By getting an on-marketplace plan during the special enrollment period, you will get far, far greater financial protection and a number of benefits which you previously had not had. And in many states, people with on-market coverage can switch to a different marketplace plan. Okay, so you can upgrade, right? So let's say you are currently in a silver plan. It may be better for you now to maybe get a gold plan, right? So you can upgrade that plan to include more robust benefits and in some cases cheaper than what you're currently paying. So that's only during the special enrollment period. But as with anything, the state-based marketplaces have a little bit different rules. So you need to check with your marketplace if you're in a state that runs their own marketplace to see if your plan switching is allowed. And by and large, it mostly is in most of the states. And also, this is super important because if you're thinking about switching, right, to get a more robust plan or, you know, a better plan, something that includes a provider that you didn't was included or whatever, if you switch plans, you may have to start your deductible all over, meaning you will go back to zero and, you know, have to meet your deductible again. However, some states have announced that they will, in fact, carry over people who switch plans. So if you had an off-marketplace plan and you've paid up to this much, you can go to an on-marketplace plan and pay up to that much as well. Now, it's a good time to remind everybody for our daily reminder that Medicaid is open 365 days a year. There's no reason that if you are or believe you are eligible for Medicaid, that you should not enroll in Medicaid now. And healthcare.gov, which everyone should know by now, will redirect anyone not only to their state-based marketplace, but will also redirect those that are qualified to Medicare. It should redirect you to your state Medicaid program. So now let's just take a quick look at what are some kinds of the financial help that may be available to help you lower your cost. Okay. Now this is why we're all here, right? So the ARP enhanced this premium tax credits to allow those individuals to qualify at all income levels. And it's estimated that 92% of marketplace enrollees will now qualify for some form of assistance. That is huge, okay? And we're gonna walk through that in the next slide, or in this slide rather. Sorry, okay. So knowing that you may qualify for some financial assistance should be sufficient enough incentive in order for you to go and verify if you're currently enrolled in a marketplace plan, how much more you will qualify for. So if you're currently between 100 and 100% of the federal poverty level, you're eligible for a silver plan at zero premiums and significantly reduced deductibles, okay? Like zero. So you may be paying a lot more than that now. If you're between 150 and 400% of the federal poverty, you're going to see a significant shift in the amount of subsidies you would receive or currently would receive if you were new to the plan. And this is the big one. If you are above 400% of the federal poverty level, which in 2021 was 51,520 for an individual and 106,000 for a family of 4. Okay, you were previously ineligible for subsidies, which was the majority of people, not the majority of people, but a lot of people. But now you're eligible for help. So it eliminates this, what was known in the policy wonky thing was the subsidy cliff. At 400% of the federal poverty level, you were cut off from any sort of assistance. So people now above 400% of the federal poverty level will pay no more than 8.5% of their annual income for premiums in a silver plan. It caps the amount to 8.5% of your income on a marketplace plan. Therefore, you will never be required to pay 9% of your income on a marketplace plan, and you will be eligible for subsidies. And this is that 92% of the population. And that's a huge boost. And now for the best part, next slide, please. These enhanced subsidies are retroactive all the way back to January 1st and are available for the entire 2021 plan year to anyone who qualifies and enrolls in marketplace coverage. And that includes anyone who got a marketplace plan during regular enrollment, 2021 open enrollment, or enrolled during this special enrollment period. So that means you are saving for the entire year, even though the change only started in May. So you will be getting all 12 months of these savings. And this is one of the things which we know is available for not only the plan year 2021, but 2022 as well. Okay, and now I'm going to turn it over to Mark, who will walk you through how much you can save with some of these changes.
Sure, thank you, Marla. I just wanted to kind of drill down on what Marla was talking about and how big a difference this can make for people in certain income groups and certain parts of the country. As you can see on this slide that was put together by the Kaiser Family Foundation, the amount of the premium savings won't be constant. It will vary. And one of the big factors is the part of the country that you live in. It depends on what the cost of premiums are in that area. And as you can see on here, certain areas are a lot more costly than others. Areas like the darkest shade in Wyoming have premium savings that can be well over $1,000. Obviously, it's a state with a lot less competition. Some very high costs for transportation, things like that. So the savings would be a lot greater than in other areas. But overall, Kaiser estimates that people will save about $70 a month. But as I'll get into in a second, that will really depend on where you live, how old you are, and what your income level is. Now, in this chart that was put together by healthinsurance.org, really does a good job of breaking that out. As you can see, for a younger person that's at the lower income level, $18,000 a year, currently they got a subsidy of about $193, and that just went up to about $250. So it's not a big difference, but where it really benefits them is that there will be free coverage now available at certain plan levels. The amount of the subsidy, just like before, is based on what was called the benchmark plan. It gets very detailed. That was the second lowest cost silver plan. But basically what happens here is that as you get older and go up in income, you will see a dramatic difference in the amount of premiums that somebody would have to pay. If you look at the end of this chart, for a family of 4 that currently were not eligible for any subsidy if they made over $106,000 a year, that was the 400% of poverty, they will now get a subsidy of about $1,750 a month. So a huge difference. And that takes that benchmark premium that was about $2,500 a month down all the way to about $780. So you would pay only about a third of what you were paying prior to the American Rescue Plan. It also makes certain lower cost bronze plans free with no premium. And you still have the option of going to a gold plan using that subsidy. Even though the amount of the subsidy would not change, it's based on the silver plan, you can use it to purchase higher level coverage like in a gold plan if you chose to do that, and potentially have a lower deductible and a lower out-of-pocket maximum. So really one of the big points to make is that it is very important to shop around. Even if you already purchased coverage for 2021, go into healthcare.gov, see what options are now available to you with these new subsidies. The American Rescue Plan has basically made these subsidies available to 20% more consumers. So especially if you are just above that 400% level, which was almost unaffordable for many Americans before this, you can find options that now will be substantially lower cost. And again, just because you have coverage already for 2021 doesn't mean that you are limited just to that plan. You now have the flexibility to shop around and find one that potentially could be a significant savings to you for not only this year, but 2022. I will turn it over to Miriam for the rest.
Thanks, Mark. I am going to talk about some additional provisions in the law that can help people who are experiencing or have experienced unemployment at any point in 2021, potentially in 2020 for some people, who experience job loss or involuntary reduction in hours, any of those types of economic fallout from COVID. And that is, there are almost inconceivably, the three of us have sometimes questioned each other, like, are these benefits really as good as we think they are? They can't be, they are. So if you are in the category, you are someone who has received unemployment insurance benefits at any point in 2021 for as little as 1 week, you may be eligible for really big time enhanced marketplace subsidies. So many people in this category are going to be entitled to a benchmark silver plan for $0 premiums. And in addition to that, substantial help with your out-of-pocket deductibles and cost-sharing obligations. There's a kind of niche category for whom this may be especially important, and that is people who are living in the 12 states that have not yet expanded their Medicaid programs to cover all low-income adults. prior to this, there's another, Marla talked about the subsidy cliff. There is another gap in the Affordable Care Act, which was if you live in a state that hasn't chosen to expand your Medicaid program, you can earn too little to qualify for any help in the marketplace. And under this unemployment benefit provision, that goes away. So if you're living in one of those non-expansion states, you don't qualify for Medicaid because your state hasn't expanded. And in the past, you earned too little to get help with your premiums for an ACA plan. You now qualify for a $0 premium marketplace plan for 2021. And costs, again, that help with your out-of-pocket expenses. Another category of people who should look very carefully at this provision is, like Marla said, we very much hope that no one in our community is uninsured, period. But we know there are some families where maybe the children are the people with a bleeding disorder and they're covered by CHIP, and the parents have found it too expensive to get insurance for themselves. Really healthy families should have all members of the family insured. And so either the more generous marketplace subsidies in general, or this uninsurance benefit may make it possible for the parents to make sure that they too are covered. Mark, if you could go to the next slide, please. So there are some caveats with this special benefit for people who have received unemployment insurance benefits in 2021. One is you have to also meet basic eligibility criteria for marketplace subsidies. So one of the main ones here is you can't be eligible for other large group insurance. So you can't have subsequently gotten a new job with insurance benefits that you could be choosing to take advantage of, but you choose not to. In that case, you are not eligible for marketplace subsidies. And similarly, if your spouse has an offer of insurance through their job and that insurance could cover you, you are not eligible. So you're not eligible for marketplace subsidies in general, and you are not eligible for this extra subsidy for people who received unemployment. This special subsidy for people who received unemployment benefits is only in effect for 2021. Some of the provisions, some of the enhanced subsidies are available in 2022. These are not. These are only in effect for 2021. But if you're eligible and you qualify and you need insurance in 2021, you should go for this. And the last of these points is probably the biggest, and that is the American Rescue Plan was passed in March. Frankly, healthcare.gov is scrambling to kind of backfill and set up their systems to make these new benefits available. And so with respect to the unemployment insurance benefit in particular, it has been difficult to implement this. So the enhanced subsidies for people who received unemployment insurance are not going to be fully phased in until this summer. That means a couple of things. It means if you're eligible for these enhanced subsidies because you received unemployment insurance, for right now, you're going to be paying at the general marketplace rate. That is subject to the extra cost savings that Marla talked about, but you're not necessarily going to be eligible for zero premium yet. You may have to go back into healthcare.gov in the summer once these systems get fully phased in and reset your premiums. But you should also know that your cost savings are going to be retroactive. So the extra money that you save by virtue of this enhanced benefit for people who received unemployment insurance will be rolled into your tax refund when you file your 2021 taxes next year. So if you need insurance now, you go to the marketplace now, you get the generally boosted premium assistance, but not the special unemployment. So you have to pay some, and retroactively, once this is fully phased in, you will be moved into zero premium. If you are not in the marketplace, if you are already in the marketplace, you go in later this summer and reset, and that gives you more money in your pocket now. And as Marla is going to talk about, if you don't reset, it will be more money in your pocket later once you file your taxes. Next slide, please. So there's another special benefit for people who may have experienced job loss, and that is premium subsidies for Cobra. So if you were laid off from a previous job, if you experienced an involuntary loss or reduction in hours in your employment, and you are entitled to extend former coverage under Cobra. So you had insurance in your old job and you were allowed to extend that. You may be eligible for 100% subsidies for your Cobra premiums for up to 6 months, ending September 30th. Once again, there are a bunch of caveats. This provision doesn't create or extend the eligibility period for Cobra. You still need to be within that 18 months of eligibility because Cobra generally provides that you can have 18 months of coverage after a job loss. After 2021, again, I said the 100% premium subsidy is only 6 months long. So after September 30th, you will either have to pick up the full cost of your Cobra premiums again, or alternatively, the healthcare.gov has announced that that will be make you eligible for a special enrollment period. So at that point, you could go to the marketplace and apply for marketplace coverage and get some of these lower cost premiums for marketplace coverage. Again, other limitations, you can't have an offer of group health coverage. Say you found a new job, so you can't have an outstanding offer of health coverage through your new job. You can't have an offer of health coverage through your spouse's job. You can't be eligible for Medicare. And if any of these things happened while you're on Cobra, you would have to announce that change to the Cobra administrator. How does this work? Employers are supposed to give notice to all Cobra eligible people of this benefit. And they had until the end of this month, May, to give that notice. And then you have 60 days from that period to announce that you want to take them up on this offer. Your employer should have forms that allow you to enroll. And if your employer doesn't have forms, you can go to the US Department of Labor website and you can download the forms from there. You will not get payments. You will not receive payments to cover your Cobra premiums. Your employer will start paying those premiums themselves. So you're not getting a check and then in turn cutting a check to pay your Cobra premiums. The employer is covering the costs. The employer is getting a tax credit for the taxes that they pay, and that's how it is financed. So one last caveat is that Cobra in a traditional world is available for a number of reasons, including like you're turning 26 and you're aging off your parents' plan. This special subsidy for Cobra premiums that is only 6 months long only applies in cases of involuntary loss of employment or loss of hours. It is really targeting people who were impacted in their jobs by COVID. So with that, I think I'm going to turn it back to Marla to go back to the marketplace plans.
Thank you so much, Miriam. I know it's a lot. I did upload into the chat. You should see 2 files for you guys to download. One is the Department of Labor Cobra form that Miriam mentioned. And the second one is what we're going to sort of walk through now, because the real question is, is how do you go about updating your information in general, right? In theory, it should be pretty easy, right? There are two buttons right there with the indicated by the red arrows that say update your info, and it should be there. But considering that they were trying to retrofit this in a way into their existing platform, it's been a little less seamless than some had hoped. So we created that updating marketplace account form, which gives very detailed step-by-step instructions, which do work, right? They seem a little bit convoluted, but provided you follow the instructions, you can, for federal marketplaces, you can go ahead and update your information that way. And that being said, right, this is just in general guidance for the federal marketplaces, how they're handling this update. State-based marketplaces will likely be different, but are doing a wide variety of approaches with respect to the updates. And some are doing it behind the scenes, like I live in New York, so that's why I default to that. So that are doing it behind the scenes, you can, not worry about it in a different way. So you'll need to check with your individual state marketplace to see what they're doing and how they are updating that, what information you need to provide if you're updating your information. But hopefully you guys, I just received a message that said they weren't able to see the files, and I'm not sure why that is. But I will check. Either way, we will send the files at the conclusion of this presentation. They should be downloads. I'm not exactly sure how they would be there, but I can check for that in a moment. So, but this is all to say there may be stumbling blocks because they, as Mary mentioned, trying to retrofit the system to work in this way, and it may take time. So it's not always the easiest thing to navigate, and it's highly variable, but there are navigators and assisters who did receive a huge boost in funding in part here, but that will walk you through this. So if you need help signing up or are currently ineligible and would like to be eligible, go to call your assister, your local assister or navigator. And if you go to healthcare.gov, it will redirect you to how to find your local navigator or assister, because they will stay on the phone and walk you through this. They know things that we don't know, right? And they have like behind the scenes knowledge, if you will, on how to update that. But they're also the same people that will help you look at plans, right? They may not know a whole lot about bleeding disorders, but in most cases, whether you're updating your eligibility information, they don't need to know about bleeding disorders at all, right? And they will be able to sort of guide you in terms of how much cost you're saving or not saving. Next slide. Okay, but what happens even after all this, and we're telling you you're going to save $700 a month and it's retroactive and whatever, but what happens if you forget to update your information, which you're not going to forget? I want a universal assurance from everyone on here that you're not going to forget to update your information. But never fear. As Miriam mentioned, you will receive the additional when you file your taxes. So, right, you're sitting here going, well, how am I going to get January through May? Well, the good news is when you file and reconcile your 2021 federal income taxes, you should receive that credit in there, right? So that's how they sort of reconcile and fix that. But at the bare minimum, everyone on this webinar should update and review their options. Why? Because you may be able to choose a plan, first of all, with lower out-of-pocket costs for the same price, or pay less, right? If you fall into that gap by which you were over 400% of the federal poverty level. And next slide. And now it goes back to Miriam.
So this has been a ton of information that we've thrown at you. So this is just kind of a summary of what happens and when. The enhanced marketplace subsidies, these are the ones that Marla has described. They are available at every income level, potentially. They are in effect now. They will be in effect for the whole 2021 plan year and for all of 2022. And those are the ones that you can receive savings now if you go in and update your application as Marla described. These are the savings that can apply if you've been over that 400% level and you switch from off marketplace to on marketplace, because the savings are only available for marketplace plans. So those are in effect now, and they're in effect for the rest of the year and for 2022. The Cobra premium subsidies that I talked about are in effect now, but they are very limited. They are only in effect through September 30th. And again, they are only available to people who are entitled to Cobra because they lost their jobs or they had an involuntary reduction in hours. And then finally, the special benefit for people who received unemployment insurance benefits in 2021. Those are in effect, but they're not implemented yet. So they will be implemented in the summer of 2021. Again, some of those savings for the months that like starting now will be rolled into your tax refund for next year. And these special savings will only last through the rest of the year. This is the $0 premiums plus the cost sharing assistance if you received unemployment insurance benefits in 2021. Next slide, please, Mark. And so this is kind of a to-do list. If you don't have insurance coverage, please, please, please get insurance coverage. Go to healthcare.gov. There are affordable options available. And there is, as Marla said, there is now greatly enhanced navigation assistance. There are people who can help you through the process. You can always backfill and check with your social worker, you know, to make sure that the plan is good for someone with bleeding disorders and so on. If you already have marketplace coverage, go back into healthcare.gov. This is the process that Marla was just describing, where you can get the savings on what you're paying out of your pocket going forward for the rest of the year. You might decide to keep your current plan, but you will get bigger subsidies and pay less. You might decide with the new subsidies to upgrade your coverage, to move from that silver plan to a gold plan. And so at that point, you've got some additional work to do to check where you are in your progress towards your deductible, and check whether those payments that you've already made out of pocket or carry forward onto a new plan. And again, if you currently have off-marketplace coverage, either the non-compliant plans that Marla described, or a plan that covers all the ACA benefits, but you didn't qualify for subsidies before, so it was cheaper to buy off-marketplace. Now you might want to look on marketplace and see, do you get subsidies for essentially the same plan? Can you switch to an on-marketplace plan, save money, and again, paying careful attention to where you are on your deductibles and whether that carries forward. And then finally, if you have experienced employment loss, explore whether you're eligible for subsidized Cobra through if you had insurance before and in your prior job, and recognize that that will last through September 2021, and or explore whether you're eligible for the extra savings on a marketplace plan, recognizing that some of those extra savings will not be fully implemented until the summer. And so with that, I think we have a whole bunch of questions. And oh, Mark, there was one more slide, which is this team has worked on an information sheet that is on both of our websites, both the HFA and NHF website, that lays this out in case you didn't remember all the ins and outs of all this fascinating information. And there are resources on healthcare.gov, and you can always contact us.
And I did put those 2 links in the chat for everybody to the full document, which is posted in the chat. Unfortunately, I thought we could upload the documents. Apparently you cannot. I can upload them. I'm not sure where they are, but they are in fact uploaded. So let's go through some of the questions. Okay. Will any of these savings be available to those on an employer retiree plan? And universally no, right? So all the savings we talked about were specific to on marketplace plans. So let's say you had an on marketplace, the same exact plan off the marketplace, it wouldn't qualify for premiums or subsidies, which is why we went through and said, if you want a marketplace plan now and before it was unaffordable, you should switch to consider a marketplace plan, because that's where the savings is. And the next question is, I currently buy insurance that is from my wife's employer's retiree plan with a third party, almost $1,200 a month for both of us. Can we get credit without buying in the market? And no, same rule, right? Okay. Okay. Are the subsidies refundable if you don't owe income tax for 2021? And I guess I'm a little bit confused by what is meant by refundable here, but even if you don't owe income tax, you still have to file income tax. So in that filing is when you would receive any unused portion. Correct, Miriam?
Yeah, I think that's right. You would get it as an income tax refund. So, yeah.
Okay, and then where are we? Okay, I'm still scrolling. Okay, if we have someone who we know is uninsured and needs some help to apply, where can we send them for this help in enrollment? And I think the first step is, right, it depends on how much assistance they actually need, right? Or is it just like someone to walk them through, right? A lot of the HCC social workers, I personally run the conference myself, so I'm aware that they know how to do this. But again, the assisters and navigators have seen a huge boost in funding, so they should be available to answer any questions you have, and they will walk you through this process, and they will very well, and they're trained and they're highly qualified and trained.
And I would just add, please do not be put off by the list prices that you first see when you go into healthcare.gov. Even before this law, 80% of people qualified for premium subsidies on healthcare.gov. Now they qualify for much larger premium subsidies, especially at low incomes. So it can be daunting when you open up healthcare.gov and it says $582 a month or something like that. That is, you know, it's the list price. It is not what someone will end up paying either before this law and especially now after this law. And that is where the navigators and assisters who come from healthcare.gov can help. And as Marla said, the social workers at HTCs are phenomenal resources.
And we could also, you know, we also help, you know, community members all the time. What I will say is important is that we had mentioned browsing and looking at plans, right? Without creating an account. Those are estimates, as Miriam just said, right? Because in order for them to make an accurate determination about how much money you would pay in a month in premiums, they need to know very specific things that are related to you, your income, and your taxes, right? So even then, it's just an estimate. And I know a lot of people don't want to create accounts, they just want to see, right? There are a number of calculators that will give rough estimates based on your current financial situation. Kaiser Family Foundation has a great calculator, and I could drop that in the chat soon as I find it at the same time. And they have, but these are all estimates, right? So if you're sitting here going, well, it's still too high. Well, that's because it's an estimate, right? Because it's ballparking the amount of savings you would have, right? Like your only true way to see how much savings you would have is if you enter the accurate, correct information and fill in an application and have everything verified.
And one last piece of advice, it is an evergreen piece of advice, and I know that all four of us on this panel have probably said it, so we're blue in the face. Please look beyond the premiums, because right now, like a bronze plan may have the lowest premium, but you know what? You may get substantial cost sharing assistance with a silver plan. So not to mention some of the areas where things are kind of topsy-turvy and gold costs less than silver, or that gets very complicated. But, you know, unfortunately, insurance is hard. You have to do some homework and you have to use math, and all of those things are, you know, can be off-putting. But the upside is, as Marla led off with, there is good news here. There are savings available. There are great opportunities available. And how often have you gotten to hear any of the four of us say that in the last couple?
I know. I feel like we should just say it over and over again until someone says, chimes in with, I save $700 a month. Oh, please be. Thank you all. No, I was like, I want someone to chime in saying I save $600 a month. And I do think you're leaving money on the table, right? If I mean, it will come back to you in terms of when you file your taxes, but it is super important that you look through the information and do update your information. Because you know, again, we can only ballpark it with respect to how much you will actually get back, but it's kind of hard to, you know, say how much you will get back without having your information specifically. Okay, under Cobra, if you too early retirement due to a reduction in employment hours and are now allowed to take Cobra, does this apply under voluntary layoff? Employment layoff. Can you get on? You know, is that considered a Cobra eligible thing? I think voluntary retirement wouldn't apply, right? But unless the voluntary retirement was not in fact voluntary and the only reduction in hours was due to, I don't know. I'm going to defer to Miriam on that.
I'm a little unclear on exactly what's going on with that question. So I did just drop into the chat some FAQs published by the US Department of Labor that talks about specifically about the new premium subsidies and who is eligible, who isn't under.
Oh, and maybe Miriam could also drop in the Cobra link, or is that the same?
This is the Cobra. There is an additional resource that Labor has that's about Cobra generally, like not specific to the rescue plan. But honestly, if you open this link that I just put in the chat, it is a 10-page document specific to the new law. And the first link in the 10-page document is to their basic Cobra FAQs.
Yeah.
So,
there's a lot of information which is available and is out there that should be of assistance. And again, we will send the market updating your marketplace account, which the detailed instructions. And that, oops, new questions. Is the subsidy help available only towards silver tier plans?
that's a great question.
That is a very great question.
It is not. It is available at all tiers. Where it gets confusing is that 8.5% cap that Marla talked about. So the higher earners, people who earn above 400% of the federal poverty level, they didn't used to be eligible for subsidy help at all. Now they're eligible. They don't have to pay more than 8.5%. That is 8.5% for a silver benchmark plan. So that's just the metric. You can take that subsidy and apply it to a gold plan. You can take your subsidy and apply it to a bronze plan, but the benchmark is that benchmark silver plan. So
there was,
but a great question.
Yeah, so there was like a very policy wonky theory behind silver, what was called silver loading, and how they calculate subsidies based on that. And it was like the middle of the road kind of compromise with respect to how we're going to offer subsidies and to whom, in a way. And that's super wonky, and like but it's everywhere and for all people, like all plans, if you're eligible. And then we had one more that came through email. Hold please. So in past years, I've looked into marketplace insurance. I've been told my family earns too much for premium subsidies, but insurance for my family of 4 would have cost us $2,500 a month to a marketplace plan, and we couldn't afford that. We'd save money now.
And that's where that eligibility, the subsidy cliff no longer exists. Even if you're over 400% of the poverty level, even if this, I think you said family of 4 earns more than $106,000, they will not pay more than, and it goes back to the question about the silver plan, they will not pay more than 8.5% of their income for a silver plan, and then they can take that subsidy that they receive and apply it to a plan at a different tier if that is their choice.
And it's a huge benefit that the federal government is offering to anyone, right? It's to anyone in any state, in any situation, provided they qualify. So another question is I'm unemployed, but my spouse is still working and I could be covered by their plan. Can I still qualify for $0 plans, because of unemployment?
And there the answer seems to be no, that eligibility through your spouse means you're not eligible for marketplace subsidies. So,
because we didn't really get into it, but there are other aspects that make you eligible or ineligible for ACA stuff based on family and affordability and ESI and employer-sponsored health insurance that our hope will be fixed soon. There is a lot of talk from a lot of policy folks that say that, first of all, that the enhanced subsidies, so this capping at 8.5% of your income, will be permanent beyond 2022. There's a lot of talk of that, and we will 100% continue to advocate for that those changes be made permanent, because it benefits so many more people and in a substantive way. And the other thing is this so-called family glitch, which has a lot to do with affordability and whether or not the current administration will go ahead and fix this family glitch, which is in essence what they're talking about, right? If it's what is affordable, because the affordability only applies to the person employed, not with their spouse and or children. So once you add the spouse and the children, it's no longer affordable, which is why it's a glitch. The intent of that is to also fix that. And I'm just going to ask if everyone I'll start with Miriam. Do you have any closing thoughts?
I'm thrilled to be the bearer of good news. This is, these are really positive developments for this year and for next year. Hopefully it can ease the way for people amidst the wreckage of COVID to stay insured. And like Marla said, on the advocacy side, we are working hard with a coalition to make some of these improvements to the ACA permanent.
Nathan?
I just want to say thank you for everybody for joining, for asking your questions, to our panelists for the wealth of information. Keep in mind, we did record today's session, so we will get that out to attendees. If you want to share that with other community members, we encourage you to do so. But thank you so much for your time today. We appreciate it.
Mark, any closing thoughts?
Just to emphasize that the savings can be substantial, so it's definitely worth exploring. Even if you feel you're happy with the plan you have now, certainly go and take a look. You know, that example of a $2,500 premium could be as low as $750, $800. So
that's a lot of money over several months that you are owed by the federal government, which is also a rare thing. But we thank you for joining us, and we will get the resources out to you, all the attendees. We'll send the slide deck as well as the step-by-step guide on how to go through healthcare.gov and look at a marketplace plan. Not look at a marketplace plan, update your information on the marketplace plan. And as always, feel free to reach out to us at NHF and HFA, and we are all here to help. And thank you guys so much.
Thank you for joining us. Bye.